I'm Elena Flowers. I'm the director of the genomics program here at the UCSF School of Nursing. We're really coming to appreciate that genetic testing has implications at nearly all levels of society, so ranging from political to legislative and regulatory, certainly ethical, and then of course in healthcare for systems, providers, payers, and patients. And now we're also understanding that for individuals there's a role as consumers as well as patients. I was recently asked to participate in a debate by the UCSF Precision Medicine Multidisciplinary Student Alliance as a part of their day-long elective focused on implications of precision medicine for healthcare providers. My debate opponent was Barbara Koenig, and I was asked to debate from the stance of being in favor of offering genetic testing around risk for disease directly to consumers. This student-run organization is sponsored by Esteban Burchard, who is another one of our UCSF experts in precision medicine and genetic testing.
Do I see a benefit in the direct-to-consumer aspect of genetic and pharmacogenetic testing to consumers? It's nuanced. Again, in some situations there are problems to give an individual patient a test result for whether or not they have Alzheimer's or breast cancer without giving them informed information. Some companies are doing an outstanding job of educating patients on their website. We need to do a better job of communication between the companies and the patients, between the companies and the providers, healthcare providers, as well as the companies that pay for testing. So we need to have, I view it like a square in which we have the consumer, we have the laboratory that does the testing, we have the physician in between, and it really needs to be the company, the laboratory, the patients, the physicians, and the healthcare providers working in concert together.
Often knowledge does not lead to clear outcomes or clear interventions. So it may just lead to more uncertainty. We may just be parsing the way we understand uncertainty into tinier and tinier bits. And sometimes that happens. What does it mean to have a 15% risk of this particular cancer versus a 20% risk? It's probably not going to be significant in most people's lives. We know that social determinants of health are one of the most important things that affect health outcomes for the broad population, and that those social determinants of health are hard to intervene on. In some cases they interact with genetics, but many of the things that will determine your health outcome are things like income, inequality in society, exposure to environmental toxins, all those kinds of things. And all the focus on genomics inadvertently, I think, takes attention away from those considerations.
Genetic testing has an important experiential component in addition to the factual information that actually comes with the test results. And in talking with some of my students, I think they're beginning to have an appreciation for how they might counsel their patients about this experiential component. In the next segment, we're going to hear from some of my students about how discussing my experience with genetic testing might inform their future clinical practice.